Good morning, everyone. Yes, it is morning. And I just wanted to jump on here to say a few things about some of the most common questions that I get as a physician in general: menopause, osteoporosis, what lab should I get, heart disease, how do I lose weight? So these are questions that I've had for many years, and I would say I've become more adept at answering these once I really engaged with lifestyle medicine. And the unfortunate thing around menopause is even physicians, residencies, including family practice, OB-GYNs, I don't think we get adequate training. And so you really have to be mindful as a healthcare provider to educate yourself on the most common questions and how to help people fully. And so this is something I wanted to share with you. Part of our Healing Kitchen, our members will get expert workshops every month, one from expert that we invite in. For example, this month is Dr. Clapper. Next month we have Kim Campbell. The following month we have Brenda Davis, who's delightful. And then every month I also do an expert workshop that I do a deep dive in with an ebook. And last month was all about plant-based labs, what labs you should get and why. And this month is osteoporosis. I'm thinking next month will be weight loss. Hitting around the new year, people always have questions. And then probably January, menopause. And being a menopausal person perimenopause, I'm in the middle of this now. I will tell you things are different. And I think it's naive for us to dismiss women who have different symptoms. Some women sail through menopause, others really struggle. There's body aches and mood and sleep and hot flashes and sexual dysfunction. There's so much involved with the changing of the hormones. Weight gain, you'll see some changes in cholesterol and lipid panels. And unfortunately, I don't think we do a deep dive enough, especially in the plant-based space. I think we're neglected. And I think osteoporosis is neglected. It's not a topic well discussed. I think it should be probably a pediatric discussion. Honestly, we really need to do as much as we can to prevent these type of things before our young women and young men get older, because that's when we start losing our bone masses after age 30, typically accelerated around perimenopause and menopause timeframe. So with all of that in mind, and of course, weight loss, I have people, the other thing one of my newer pet peeves, and I'm trying to be very thoughtful in how I approach this, is people will say, oh, you don't have to watch your calories. Oh, you don't have to do this. You eat as much as you want on a plant-based diet and lose all the weight you can. I would say yes, to a degree, but there are people, plenty of my patients who have eat a whole food plant-based diet, look at their food logs, and they still struggle to lose weight. And why? So we go through that with them. There may be a variety of reasons, but many times they're still eating too many calories for the amount of energy that they need to burn. We don't lift weights. We don't have as much lean mass as men, for example, for a lot of my ladies. So lots of things there to go into. There's a lot of nuances, and I think each person deserves an individual prescription as far as what should they do about their menopausal symptoms. What about osteoporosis? What about preventive care? What are all these things that they should each be doing? There is no blanket answer for everybody. And anyone who says there is, I feel, being neglectful. And honestly, it's just wrong. And so have just really been thinking a lot about this. And I think each person deserves an answer to their own situation. And I understand it can be frustrating, and where do you get your information? Hence why we offer these workshops as part of our membership of the Healing Kitchen. And in addition, we do meet weekly. It's myself and Brittany every single week live. And Brittany provides 2 delicious recipes. We cook with her, and then I answer medical questions weekly. So you get the 2 expert workshops, and you get the 4 meetings with us and all the recipes. You have access to all the back recordings. So let's say you join today, you would get all the recordings from the past and ongoing. And so we really are trying to get as much information out there and help people find health in whatever that looks like for them. And so I know for myself, that is a changing horizon. I love to run, but maybe I'm thinking that I want to pull back on my running a little bit, do more smaller amounts of running every day. and do more weight training and resistance training as I'm learning more and more about how important it is building lean muscle and getting stronger as we get older, ager with our age. So with that in mind, I just really wanted to share that I will be having upcoming workshops. And if you don't want to join the Healing Kitchen, you can also join the workshop in and of itself, one at a time. And that can all be found on my website, drmarbus.com. And yeah, I'm just amazed at how much information for women in this midlife area, age group, is neglected, honestly. And I feel there's so much more that we could do. And I'm really going to try my best to provide that. And as I learn, you will learn as well. And I'm super excited to offer these opportunities to engage in conversation, ask hard questions, and let me go find them, right? If I can't or know the answer, I will find someone who does and start interviewing. I think I'd like to start interviewing people on the podcast. Sorry, the cold and Boston's making my nose run. On menopause and osteoporosis and mood and habit change, and just there's so much we can be doing every day to make our lives better. We just need some guidance and some honest discussion around all these things. And so, yeah, anyway, someone had a question: do plant-based eaters get heart disease? So how is that possible? They aren't eating any cholesterol. I would say it's not necessarily that plant-based eaters get get heart disease. They may already have it when they go plant-based. So I don't know if there's any studies on someone who's been fully plant-based, whole food plant-based since birth. And that would be the answer to that. So most of the people that I see are 50, 60, into 70s or 40s, even 50s, whatever, already have significant heart disease. That's when they start seeking answers and to change it because they got a scare. That's typically what's going on here. But what I'd like to see is that families and moms and grandmas and granddads and dads start talking to kids and help them develop a healthy palate where they're eating whole plant foods and avoid this whole conversation because they're never ill. I'm not saying that people who eat a whole food plant-based diet won't get heart disease or we're all going to die. I appreciate that, or get cancer, but at least we can control what we can. Let's not amplify the risk. For example, there is a very strong family history for me for breast cancer and heart disease. I am doing everything I can on a daily basis to consume the foods, move my body, decrease stress, sleep, to mitigate those risk factors. However, I still do preventive care. And in the sense of early diagnostics where I'm looking at mammograms and those type of things, because I don't want to risk my own personal health just because I want to live by a principle of, oh, well, I eat a plant-based diet and that means I'm never going to get sick. That's just not true. But again, I just want to have honest discussions. I don't think there's been enough of that. There's not enough women in this space speaking about it, especially in the plant-based space. So I hope you join me and Brittany as we dive deeper into all things that need more discussion: menopause, osteoporosis, weight loss. And, don't be ashamed if you're struggling and you're eating a whole food plant-based diet and you're still not seeing the numbers that you want, or your blood pressure is not where it's want. You're not losing the weight that you want. Again, I'm just really feel compelled to say that and share that. And let's just have honest discussions. Like I said, plant-based diet is phenomenal. It's the number one prescription I go to, along with everything else with lifestyle medicine. But again, this is not a panacea. There are other things that we need to consider and discuss with each individual patient. And so I hope that helps. So I'm really working on it, but check it out. It's called The Healing Kitchen on drmarbus.com. We'd love to see you there. Dr. Clapper will be coming not today, but next Saturday. And I will be doing my osteoporosis workshop on November 30th. And so again, if you can't make the live, there will be replays always available to you along with the ebook that we'll be presenting. And I think we'll eventually probably create those ebooks and make them recipes to really hone in on what foods and other things you can do. So I hope that helps. I think we just need more honest discussion. And like I said, I'm here to learn with you. Oh, there's some kitty cats back there. It's my daughter's cats. And I'm going to be looking for more experts to bring on the podcast because I think there's just such a wealth of knowledge out there that we need to get more in front of people who are in our space. So I thank you guys for joining. And I will see you next time. Tomorrow I run my half marathon with my daughter, and it's going to be cold. It's very cold. And we'll let you know how it goes. So anyway, guys, have a good rest of your day. And thanks again for spending some time with me. And I would love to hear about what questions you want to know about. Someone's saying here on Facebook they'd love to know about more postmenopause as well. Absolutely. There's the premenopause, the perimenopause, the postmenopause. And I'll tell you, yeah, the menopause thing is no joke. There's no joke. Things are different than I was 10 years ago. I'm just going to throw it out there and things happen. But unless you're a woman, it's really hard to, I think, to understand what you go through in this part of our age. Again, you guys have a great rest of your day. And there will be more in this conversation because it is a fascinating one. All right. Have a good day, everyone. Blessings.